Developmental dysplasia of the hip is also known as DDH, or hip dysplasia. It is a problem from birth where the hip joint has not formed properly. The hip is either dislocated, where the ball of the hip is not sitting in the socket, or it can easily slide out of the socket. This condition is more common in baby girls, in babies born bottom first, and can run in families. Over time, children born with a dislocated hip will walk but will have a limp. One leg is a little shorter than the other. Sometimes the older child will walk on tiptoes on the affected side. When both hips are affected, the child will walk with a mild waddle, since the muscles around the hip are not working properly. If the dislocated hip is not treated, progressive hip and back pain will develop as a young adult. How can you identify a baby with hip dysplasia? There may be an extra fold of skin on the inside of the thigh. The hip joint will not abduct or swing out as far as normal. Parents will often notice this when they are changing the baby's diapers. If one hip is dislocated, the leg will be shorter on that side. This is most easily seen when the hips are flexed up and the knees can be seen to be at a different level. The hip joint can be felt to be unstable and be clipped in and out of the joint. How can you identify a toddler or child with hip dysplasia? They walk with a limp or have a waddling gait. When just one side is affected, one leg is shorter than the other. One or both hips cannot abduct or move outwards as much as normal. An X-ray shows that the hip is dislocated. Can this be treated? Absolutely. If the baby is diagnosed before 6 months of age, they can be treated in a special sling called a Pavlik Harness. It keeps the hips flexed and allows the hip joint to form normally. We would like to treat all children in this way, as no surgery is needed and it is easily managed. The harness is removed 2 months after the hip becomes stable and can be temporarily removed at bath time. If the diagnosis is made after a year, surgery is needed to open up the hip joint and put it back into place. In older children, it needs substantial surgery as the pelvis and thigh bone have to be reset. We hope that babies born with dislocated hips will be identified early so they can be treated successfully in a Pavlik harness. This will save the child major surgery and even a lifetime of disability.